it out, and it is transformation. It is transformation due to a business model which led to processes and ultimately technology. We're not developing the technology. As a matter of fact, this is a model for the 21st century. We have outsourced all of the technology. How quick were we able to roll this thing up? 6 months. All of the technology already existed. Now it becomes a matter of rolling it out. The patents are all method patents, which is applying technology to a new industry. Thank you.
Now that's an impressive mind with an impressive company, I tell you there. Pete, thank you. Our next speaker is Jose Lacal. Jose is founder and chief vision officer for Open Personalized Health Informatics. The company is a bioinformatics startup using free software to empower consumers to improve their family's health care. A little bit about Jose. He's a graduate from here, FIU, in economics, as he states, in the pre-World Wide Web year of 1988. Launched his first startup while a full-time student at FIU. Second startup in 95. Spent 3 years at Siemens, 7 years at Motorola, and launched his third time in September of last year. Third time's the charm, I hope, here. With that, Jose.
Thank you, Michael. I guess one of the first things that people may wonder is how can a small company, any of your companies, make any difference in the healthcare market? And I think that the first way to make a difference is you need to come in and ask new questions. You know, the definition of mental insanity is doing the same things over and over again, expecting different results. And today we heard a lot about transforming healthcare, and I think that's a noble idea. But for the next 5 minutes, I want to shift your mindset. And at the end of the day, what most consumers want is not necessarily better healthcare. What we really want is better health. And more healthcare is not necessarily going to get you better health. So if I could see, if you could raise your hands, how many of you would like to live closer to the best cancer hospital in Miami? Okay. How many of you would like to keep your children away from that best cancer hospital in Miami? At the end of the day, it's not where is the best healthcare. At the end of the day, it's where can I get me the best care, the best health for my family. So I think we need to shift our thinking from improving the healthcare system for all towards the real goal of creating a care system that improves the health of the population. We have 40 million Americans without health insurance. We're spending 17% of GDP on healthcare. So there's a mismatch between what we're spending and what we're getting. So specifically, as a small company, we don't have any baggage. I find it fascinating when people talk about the waste in the healthcare industry and we're wasting 300 billion here and 100 billion there. But at the end of the day, what is waste to some of us is somebody else's profit margin. And I have yet to see an audience that's willing to take a 30% pay cut just in the name of improving healthcare. So it's going to be incredibly difficult to move an industry that feeds off these waste and inefficiencies because that's their lifestyle, that's their mortgages. So the approach I'm taking with my company is to go in the opposite direction. We have heard today how difficult has it been for the healthcare industry to adopt IT, to get on with the program, to adopt technologies from existing industries. There are many attempts to deploy what's called healthcare IT. But there are all kinds of problems, political, competitive-wise, financial, who makes the money. So with my company, what we want to do is to look at the consumer that has more IT in their homes today than most physicians have in their practices. If you look at your own home, you have at least one computer, broadband access to the internet, 1 or 2 cell phones, scanners, faxes, PDAs, iPhones. You have more processing power in your house than every physician you will ever get into. So what we want to do with our company is to provide you as a consumer with the tools to use your IT to improve your health. Two very specific products. One is a personal health record system that runs on your computer. We heard from Microsoft earlier today. Google is in the market as well. Passport MD, many companies offer web-based PHRs where you put your data on their website. The problem with that is, how do you know what's going to happen with your data? Who else is going to look at that data? And do you really trust other parties with your children's health data? So our approach is the software runs on your computer. You go to the provider. They have to give you your data by law. You put it into your system. You own it. The second element is we have built a vertical search engine for health data. I don't know how many of you realize that the U.S. government is the #1 funding source for all biomedical research in this country. VCs and everybody else usually comes in after the basic research has been done with taxpayers' money. The National Institute of Health provides about $10 to $20 billion a year in basic research funding. All of those basic findings are now publicly accessible for free. It's called open access. And recently, a couple of weeks ago, every research project funded by taxpayers' dollars has to make public all of their results within 6 months of publication. So there are absolutely terabytes of data, high-quality scientific data available for consumers. So what we are doing is we're integrating all that data and we're making it available through a website. It's called healthlibrarian.net. You can go in and we provide personalized results. So you go in and you select Hispanic, male, 44, Palm Beach County, diabetes, click. And we give you all the clinical trials that are open in Palm Beach County for people with diabetes, all the clinical guidelines, all of the 17 million scientific articles that are applicable to you, as well as all of the grants from the NIH that are relevant to your disease. So the idea, what's driving my company, is to combine this open data with open access scientific journals, all of these under an open source software umbrella. That means that the software is free. You download the software, run it in your own house, and have fun. So then the next question is, so how do you make money? If you are busy in the audience, you're thinking, so how's this guy planning to make any money by giving the software away? And that's an interesting question, but it's the wrong question. There are many companies out there trying to sell software that are going nowhere because most of the software markets are owned by a very few companies, such as Microsoft, that have a monopoly in their specific markets. So as a small company, it's very difficult to break into those existing markets by playing the same game. So we want to change the rules of the game. By giving away the software, we plan to commoditize this segment. And by giving the software away, we hope to have a broader penetration so that people can download the software, install it, and then go with it. And this is not as strange as it may sound. For all of the attorneys in the room, you will realize that most of the legal proceedings that every attorney produces may end up in the courthouse, which then becomes public record. So technically, anybody who needs any sort of legal document can go to the courthouse and copy verbatim what a highly paid attorney prepared for somebody else. That is in the public record. And yet we see that fine attorneys are always having a good business flow coming in because people want customized solutions. And that's the business model for a small open source company. You give away the software to give an idea of the value of your company, and then you provide the consulting and the services in the back end. So in closing, my message is that it's good that so many people are